In Good Shape, your weekly dose of health information on DWTV. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition and beauty. Medical professionals, therapists, and counselors are in our studio every week to offer their expert advice on In Good Shape.
And my guest in the studio today specializes in aesthetic dermatology, Dr. Maike Schröder, a dermatologist from Berlin. Thank you very much for joining us.
Thank you for the invitation.
Dr. Schröder, there's so much on offer to delay aging. Can you give us an overview about the most important methods that are used?
Yes, let me start with botulinum toxin A. This is a substance which we use preferable for the mimic wrinkling. It is injected directly into the muscle and therefore it comes to a relaxation of the muscle and the overlying tissue, and the wrinkles are getting less.
Mm-hmm. What about laser treatments? They're very popular.
Yes, laser treatments. We have now the so-called fractional laser against aging skin. This is a laser therapy where very little dots of laser light is applied on the skin, which produces new collagen in the underlying tissue and with very little damage of the epidermis.
And the collagen, of course, pumps up the skin and attracts water, right?
Yes, and you have a very more tightened skin afterwards. We also can improve the overall impression of the skin because other signs of aging are reduced.
Like age spots, maybe?
For example.
What about chemical peels?
Yes, we use them for a more smoother impression of the skin. They remove the upper epidermal cells, which
the top layer of the skin, basically, right?
Right, and by reducing these damaged epidermal cells, the skin becomes more bright and glowing.
What about another method, the dermal fillers, like hyaluronic acid, like collagen, when it's injected into the skin? What effect does that have?
The dermal fillers, we like to use them to give the skin more volume, for the cheeks. The contour of the face can be enhanced. Also, the volume of the lips can be improved.
Mm-hmm. From your experience in the practice, you do all these things with your patients. What has the best results?
It depends on what you want to achieve and what the patients want. If, for example, the mimic wrinkling is the most thing that bothers the patient, we would give him botulinum toxin A. If he complains more the loss of volume, a dermal filler is perfect.
Mm-hmm. So you have to talk to your doctor, tell them what you expect. And, well, talking about expectations, how big are the changes? Many people might think something drastic is going to happen. What can you expect as a patient?
Well, all these non-invasive methods last for a certain time. So after a couple of months or years, you have to repeat this procedure. For example, botulinum toxin A lasts for about 4 to 6 months. Then it can be repeated. The dermal fillers depend on what filler you use, but if you speak about the resorbable fillers, they last for about 6 to 12 months.
Mm-hmm. And many people have written to us about side effects. That's a topic that worries people. Our viewer Nadine Koboretsky from France has asked about the side effects of Botox.
Side effects of Botox are quite rare. What might occur is a little bruising or swelling directly on the injection site, but this disappears after some days. Maybe the patient can feel a little dizziness or headache, but also this goes away after some days.
Mm-hmm. And briefly, what can you do to keep your skin younger looking in the first place?
To prevent skin damage, you have...
Smoking is a factor, I believe.
Yes, of course. We have the so-called extrinsic factors of the aging of the skin. One of this is the sun.
It's probably the worst factor, right?
Sun is very important to prevent the skin.
So use sunscreen. That's your main aspect in preventing skin aging, right?
Yes, prevent sunburns and also use sunscreens as often as possible. But
well, thank you. That's all we've got time for today, unfortunately. Thank you very much for being with us. Thanks for your time.